My name is Camryn, and I'm a level 2 Mohawk Master Nursing student, and today I'm going to be demonstrating how to give a subcutaneous injection and an IM injection. Um, yeah, so first off, I'm going to look at the medication administration record to go over the medications that we need to be administering today. So the medication order that we have is for Mario Mancini, and his order is 5,000 units subcutaneously of heparin, Q12 hours. And he also has an order of Halidol, 1 milligram IM, Q4 hours, PRN. So today we're going to be administering both of these medications. Next, we need to go over the 8 rights of medication administration. So first off, we want to do the right patient. So I've checked, and as when I go into the patient's room, I'll be checking his name bracelet and asking him to repeat his name and making sure it matches the MAR. We're going to make sure I'm using the right route. So we're doing subcutaneous and IM today. We also need to make sure that we're using the right medications, which I'm getting set up here. We want to make sure we're having the right dose, so I'm checking that on the medication administration record, the right site. So we want to make sure that we're giving the needles in the right site on the body, and we also want to make sure that we do the right documentation after the medications are given, as well as checking the documentation before we give the medications. And we also want to make sure, lastly, that we give them at the right frequency. Okay, so today we're going to be giving the subcutaneous injection first, so I'm just going to start off by washing my hands before I do anything else. So it's important to take into account the size of the patient before you're giving them an injection, because you need to adjust the needle size accordingly. So for this injection, Mario Mancini is just of average weight, so I've chosen to use for his subcutaneous injection a 25 gauge needle, which should be adequate to get the medication where it needs to be. And I've also chosen a syringe that goes up to 3 milliliters, since the correct dose of Mr. Mancini's medication is going to be 1 milliliter. This is an appropriate syringe to use. So first I'm just going to start by drawing up the medication using a blunt tip needle, so that the other needle that we're going to be injecting into the patient doesn't get damaged while we're drawing up the medication. So I'm just going to get that set up. And I've also made sure to check Mr. Mancini's allergies before I'm giving him any medication. So he does have one allergy, which is codeine, but we're giving him heparin today subcutaneously, so there's no conflict there. So you just start by twisting the blunt tip needle onto the syringe like this, and then carefully take the cap off, and then we're going to make sure that this is the correct medication and drop the correct dose. So I'm going to make sure I'm drawing up 1 milliliter. Okay. And then I'm going to have to switch the blunt tip needle to the needle that we're going to be giving to the patient. So it's really important to be careful when we're switching the needles. Okay, so I just take that one off, and then I set up the subcutaneous needle and just twist that one onto the syringe. And then I can leave the cap on while I'm writing down the medication label that I'm going to put onto this medication. So this one just has all the patient's information on it. And this is important because, especially because I'm giving 2 injections today, I need to know which medication is which. So I'm just going to put that, I write down the information and then just attach it to the syringe like this. And then after I'm done that, just take off the cap carefully. And then this needle is ready to give to the patient. Okay, so now I'm going to be preparing the IM medication for Mr. Mancini, so I'm just going to be getting this one ready next. So for this medication, I have chosen to use a 21 gauge needle because it's an IM injection, and Mr. Mancini is of average weight, so this is adequate to get to his muscle. And then again, I just have another blunt tip for drawing up the medication from the vial that I'm going to use first, as to not damage the needle that is going into the patient. So I'm just going to open up my supplies. Very carefully. And for this medication, the correct dose, as on the MAR, is 0.5 milliliters. So I'm going to be choosing this syringe that is in milliliters, which is very important. And I'm first going to be attaching the blunt tip needle. And carefully remove the cap. And I'm going to make sure that this is the correct medication. So this medication is Halidol, and that's what it says on the MAR as well. Okay, and we're going to draw up 0.5 milliliters. Okay. And then I'm going to carefully put the cap back on to switch the needle to have it be the appropriate needle for this injection. And again, I'm going to grab a medication label that I have right here, and I'm going to put all the patient's information on it and say which medication this is, so that I won't get it confused with my other injection that I'm doing. Okay, I'll attach that, and then I can remove the cap once I'm ready to give the injection. We prepared our medications. I have washed my hands and put on some gloves in order to give these injections. So first we're going to be giving the subcutaneous injection. So on my patient, I need to make sure that I check their bracelet and another identifier. So I'm just going to ask Mr. Mancini to repeat his name and birth year back to me as his identifiers, and I'll compare it with the MAR to make sure they match up. So first I'm going to just explain the procedure to the patient. Okay, so Mr. Mancini, today I'm going to be giving you a couple of injections. So the first one is a subcutaneous injection, and for this one I'm going to be giving it on your abdomen. So I'm just going to properly landmark. So it's going to be below your waist but above your hips, so it'll be in this region of your abdomen. And I'm going to cleanse the area beforehand, so I'm just going to use an alcohol wipe. Make sure that it's nice and clean before I give the injection. So I'm just going to cleanse it in a circular pattern like that. Okay, and then I'm going to get my needle ready. And for this injection, I'm going to be injecting it at a 45-degree angle and pinching the skin a little bit to ensure that the needle goes into the right place. So I'm going to make sure that it goes in at an angle like this. Okay, get ready. And I'm going to inject the medication. Okay. Okay, now that I've properly discarded of the first injection that I gave, I'm ready to give the second one, which is an IM injection. So Mr. Mancini, this is going to be another needle. This time I'm going to give it in your arm, in this region right here, into your muscle. So this is because it's different from the subcutaneous injection, because this medication needs to go into the muscle, which is a little bit deeper into the body, so we need to use a bit bigger of a needle. So I'm just going to get my needle ready and uncap it. And I also need to, once again, cleanse the area that I'm going to be giving the injection. So I'm using an alcohol swab to do that. Okay, now that the area is cleansed, we're ready to give the injection. So for this injection, we can just give it straight in at 90 degrees. We're going to get this out of the way. Okay. And slowly inject the medication and bring the needle back out. And then to safely dispose of this particular needle actually has a safety device, so you just clip this in like so, and then I can safely dispose of the needle along with the other one in the sharps container. Okay, so we're done giving both of our injections today, so I can remove my gloves and wash my hands, and I'm going to make sure that I properly document on the patient's medication administration record that I've given these medications, and I would also want to monitor the patient just to see if there's any reactions to the medication, and just make sure that we're checking on that, and that is it.